This is an important issue, and we want to talk about it. Hair loss, it can be embarrassing, but treatments are getting better all the time. They really are.
It is, and PRP is giving men and women a non-surgical option to see dramatic results. The Vein and Skin Center of Hawaii walked us through the process. Well, who doesn't want to have a luscious head of hair? It goes for men and for women. And there are some new treatments that we want to tell you about. We're here with Dr. Woody Chung at the Vein and Skin Center of Hawaii. Tell me about this PRP treatment.
Well, PRP is short for platelet-rich plasma, and what we do is we draw your own blood, and we use a centrifuge and separate out the platelets from the red blood cells, and then we inject the platelets back into the scalp. And what that has in there, all the platelets, they do have growth factors, and there are about 7 that are really strictly, particular for the hair stem cells, and then they cause the hair stem cells to grow. So it ends up being that your hair gets more denser, more thicker, more healthier, and allows patients to do treatments that are non-surgical.
And how exactly does that work? It sounds like you hear a lot of medical things, but when you see the pictures, that's what's going to sell most people on it.
Yes, exactly. So what we do is we recommend patients getting about 6 treatments for the first year of treatment. We do ramp it up in the first 4 months, so patients will be coming back every month and getting an injection of their own PRP, or platelet-rich plasma. And what that does is it starts stimulating the hair to start growing. The hair has 3 different growth cycles, and so we want to hit it in that growth phase. And so once the 4 months are done, then we kind of break it up to once every 3 months. And then the second year, it will depend upon the patient's density and how well they responded. And we usually recommend about 3 sessions for the second year and as maintenance.
Now, people are going to wonder, does it hurt?
There's a little pinch. We do use this very small needle, but we also have a Zimmer cooler. It's a chilling device which kind of gives a little bit of anesthesia at the site of injection, and it does seem to help a lot. We've been treating quite a bit of patients so far, and we're pretty much done within 2 to 3 minutes.
Wow, that's very quick. And how is the new treatment compared to the old one?
Well, the treatment process is the same. I mean, the schedule is the same, the injections are the same. However, what we did was we upgraded to a new device, or a centrifuge. So we're able to have more high density in the platelets and of the platelets from the blood, and so we're able to get more volume, and so in turn the patients will be getting more of their own platelets, and in turn hopefully more growth factors, and then the end result would be a lot better result.
And can this be applied to other parts of the body that you might want different results for?
Yes, we were using it for skin rejuvenation. We still do, and that seems to, after laser, after microneedling, any type of treatment to improve the skin, the PRP does help a lot, and it stimulates your own collagen and your own body to, give you more rejuvenation, basically.
All right, everyone needs that. Dr. Woody Chung, I'm sure people come and say, can we have the hair just like yours?
Yeah, well,
is that part of the option plan?
Well, we definitely would like patients to, get the results that they can achieve, and so we, recommend vitamins, and we also recommend some other medication for the male patients. And yes, I don't get PRP injections, but I do use Nutrafol, which is a male vitamin, and it seems to be helping.
All right, more advice from him. If you don't have the genetics, there's a lot of treatments that can help. Thank you for inviting us over to check it out.
Thank you for coming by.
Every time we see the before and after.
Yeah, I mean, telltale right there. It's like if you didn't think it worked, proof.
And for men and women too. So it's changing all the time. PRP, non-surgical. Go check out, find out if you're a good candidate, give them a call, and you can get a consultation.
And if you want to understand more, of course, the Vein and Skin Center of Hawaii will be able to help you. Yeah.
That's right.